Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening, everyone. It is such a great day in North Florida. Um, we are we're having a little bit of a drought, so if you start seeing some of the smoke and stuff coming from the Okefenokee Swamp, we have the perfect guest this evening to give you advice on how to deal with your smoke inhalation. So again, we are back with Dr. John Washira, our favorite pulmonologist. But before I get started, I'm going to do what Miss Turner usually does, and that is introduce my co host, which is Miss Jocelyn Turner. Okay, Miss Turner, thank you for being on time.
Well, good evening. And Dr. Kane, you don't have to air my laundry, my dirty laundry. Come
No,
on now. But good
nobody
evening,
would have
everyone.
known if you hadn't said anything.
Good evening, everyone. And as Dr. Kane said, it is a beautiful day here in Northeast Florida. And hopefully, it's a beautiful day wherever you are. I know we have listeners not only here in Northeast Florida, but all over. And we appreciate that. And we want you to continue spreading the love. And of course, Dr. Kane, we can't do this without our behind the scenes technology guru, Tyrone Jackson. How are you doing this evening, Tyrone?
I am doing well. Thank you very much, Miss Jocelyn. You missed a great conversation with Dr. Sherry and I as we talked about Dr. Kane's growth of 1 centimeter.
You
Oh,
talked
my.
about my afro. They talked about my fro. That's all it was.
That's interesting. I'm glad I missed that conversation. Well,
Me too.
well, we are pleased to have Dr. Wachira join us again this evening. And as Dr. Kane says, he's our favorite pulmonologist. And tonight every week, I should say, not tonight, but every week, I think we bring conversations that inform, inspire, and empower our community to take charge of their health and well-being. Tonight, we're talking about sleep apnea, a condition often dismissed as just snoring or being tired, but in reality, it can have serious and sometimes life-threatening consequences, from heart disease and stroke to mood changes and daytime exhaustion. Sleep apnea can impact
Don't
every
steal
part
our guest intro.
of a person's life. And I think about people, Dr. Wachira, and welcome back. How are you doing this evening before we delve into the topic?
Absolutely. I'm doing excellent. Thanks for having me back again. I really appreciate the trust and the responsibility. And again, I'm going to sound like a broken record. I thank you for what you guys do. I had a real good chat with Tyrone. I'm not going to air your dirty laundry. And let me just say, I had a good chat with Tyrone earlier. And
Reported dirty laundry.
and he was educating me on all the work that you guys do and your audience, and so we thank you for the impact that you make in our community.
Thank you. And every time we finish the podcast, someone always texts me either during the podcast or afterwards to also express their sentiment. So I also would like to, at this time, thank you, Dr. Wachira, and as well as our audience who tune in from week to week. We're not where we want to be in viewership, but we're going to get there. We're going to keep striving. And after 203 episodes, I think we're doing okay. And, we'll get there, right? As my dad used to say, Rome wasn't built overnight. So this is also not being built every night. So let's delve into the hidden dangers of sleep apnea. Dr. Richira, can you start by explaining what sleep apnea is and if there are different types that people should know about?
Absolutely. So sleep apnea is a sleep disorder that is characterized by either partial or complete collapse of your airways. And Tyrone, if you want to go back to my picture, because I think this is quite helpful just for folks to understand kind of what we're talking about. The image on your left, or I should say my left, is normal kind of upper airways, and what we're seeing there is we're seeing the tongue as the floor of your mouth, and then we have two palates. One that's not being shown here. The roof is what we call. It's composed of the hard palate, and then on the back side you have the soft palate and a structure that we call the uvula. Now you can see the picture on the left, the blue arrows. That's just air going through your nose and through your mouth, and it's going all the way down to your lungs without being obstructed or being kinked or anything like that. Now, if you move over to this picture on the right side, you see that the tongue has moved further back, or you can even argue maybe the soft palate has relaxed, or the uvula, which, by the way, both the soft palate and the uvula, they're muscular structures, so they're made up of different muscles. So when the younger that you and I are, the more tone those muscles are, just like any other muscle. And if we have extra tissue around our mouth or around our neck, or as we get a little bit older that we're going to talk about here, those muscles tend to relax. And so when they relax, what ends up happening is you have that block airway that you're seeing on the right. And that essentially is what sleep apnea is. It's really when those muscles or those structures, for whatever reason, relax, and then they end up obstructing that part of your airway. And as most of us know, the way we were created, like we're doing right now, is we are breathing in, and equally as important, we're breathing out. So we're breathing in oxygen, and equally as important, we're blowing off your carbon dioxide. That's just a passive motion that's happening right now while you and I are awake. So you can imagine when you have that happening, when you have that tongue or that soft palate or that uvula blocking the top of your airway, that exchange, that God-given exchange is not happening. And, we're going to get into, some of the conditions that are associated with sleep apnea. And essentially, that's the fundamental explanation why all these conditions are associated with sleep apnea. It's that exchange of your oxygen levels in your blood dropping and your carbon dioxide levels rising.
Dr. Washira, on this picture that you have, Tyrone, go back to that picture. So, that loud snoring, I didn't know if you were going to get into it. The loud snoring effect, can you tell us based on this picture you're showing, and for those of you who are not joining us by way of visual effects, you're missing a treat. But tell us what happens to give us that snoring sound.
Absolutely. So as you can imagine, the picture of the patient on the left, again, the plumbing is nice and open. Everything is flowing like it should, right? There's no kinks, there's no blockage, so there's really no noise, right? The patient on the right, however, you can try and imagine oxygen trying to flow through that blockage. Now, again, remember, the airway could collapse partially, or it could collapse 100%, complete collapse of the airway. It all depends on the severity of what's causing the blockage. So what happens is, we have this kind of God-given survival reflex. And what happens is when your oxygen number drops and your carbon dioxide number rises, then your brain sends a signal to tell your body, hey, there's an imbalance of our oxygen and carbon dioxide, and we need to wake up so that we can kind of remedy this problem. And so there is a transient arousal or awakening, and it's very, very short, to the point where most people don't even remember waking up. And so when they do that, there is what's called a sympathetic surge, because, you're basically, it's a reflex, it's a survival reflex. And when you have that kind of survival reflex, it's a fight or flight sort of reflex. So you tend to produce your adrenaline and things of those nature. And we'll talk about more about that. That's why sleep apnea is associated with heart issues and strokes and high blood pressure, because you're producing these hormones that you and I tend to produce, when we have to fight or flight. But to your point, Dr. Kane, that transient arousal or awakening causes the patient to gasp. Sometimes they can snort or gasp or choke, and that's that reflex of waking up transiently, so you can breathe in oxygen to replenish that low number, and equally as important, eliminate your carbon dioxide that's rising in your blood.
I remember when one of my friends, and I'm going to let them be unnamed, but when she was talking about her husband, and she said she was happy that he got a CPAP machine. I said, "Well, is it loud?" She talking about not louder than that freight train that I used to hear before.
Yep.
Before he got it. So when you were talking, I was remembering when she said that. And what I don't understand, I think the main part that I want people to understand is that it's not just a matter of the inconvenience of you now having to sleep with a machine.
Right.
It's what you said, the risk of a heart attack or a stroke. And I don't understand why people just don't get that, and why is it so difficult for them to do the regimen that they are prescribed by their physician?
Because a lot of them are not told, unlike the patients that go see Dr. Washira, a lot of them are not told the consequences or explain the consequences of that. But Dr. Washira, go ahead.
Yeah, no. Well said. You're right, Ms. Jocelyn. This is a common complaint that I get up front from the patient, even before they've tried it. They're fighting it. And I think a lot of that is just conditioning, and it's a mindset. I mean, you're setting your mind on the wrong things, and you're failing to recognize that. I don't expect you to tolerate the therapy right off the bat. We can work towards tolerance over time. And frankly, one of the greatest analogy that I use that has been very, very effective is COVID. And I think all of us can recall, at the height of COVID, all of us had to wear a mask, right? And initially, even me as a physician who has to wear a mask around the hospital, having to wear that mask just about everywhere, took some getting used to. There's a level of claustrophobia that all of us had to kind of overcome with time. And the key was, the longer we wore those masks, the more desensitized we became, to the point where it became norm. You go to church, you're wearing a mask. You go to the store, you're wearing a mask. You're not even thinking about it, right? And it's the same analogy that I use with my patient. I say, listen, initially 100% it's going to be uncomfortable. So let's just accept that. But what you're going to realize is the nights that you use it, and even the longer that you use it, you're going to recognize that you feel better, that you sleep better, that the following day you have more energy, that you have you just have more stamina to do the things that you want to do. And so once you educate them that way, and you set those realistic expectations, they might wear it, like, for the first week, they might wear it for an hour and a half. The second week, they might wear it for 2 hours, 2.5 hours. Within a month or two, they're wearing it for more than 4 hours, and they're telling you, doc, you're right. So I think, like Dr. Kane said, I think we need to do better as physicians, explaining what sleep apnea is, explaining what it's associated with, and explaining that, yes, there are growing pains, but on the other side of the discomfort is going to be a higher, better version of you. We just got to get you there, and it's teamwork. I have a part to play. I have to get you a mask that you can tolerate. I have to get you settings that you can tolerate. And then your part is to work on that desensitization process, and then also work on your mind. Don't go into the thinking you're going to hate it, you're going to fail. Let's attack it with the right posture, and we're going to be successful on the back end of this thing.
We had a question from one of our viewers. Is there a correlation or an association with high blood pressure, or what does that do to blood pressure?
Yeah, it's a very good question. Now, let me go back to, again, another analogy that I use with my patients. What would happen to all of us if we would try to drive our car with an empty gas tank, right? That car would not function to its capability, right, or to its capacity. You know, the engine would stop, things would break down, you know, and eventually we would just damage everything that comes with the car, right? So oxygen for you and I is fuel or gasoline to the car, meaning every part of your cell, every part of your body requires adequate levels of oxygen. Now, again, that's why I started this talk with that picture, because what I showed earlier is when you have that blockage, whether it's partial or complete, it is affecting that balance of oxygen and carbon dioxide levels. And like I said, what ends up happening is if those levels drop to the set threshold, a lot of times it tends to be about 88%, depends on who you ask, then your body goes into this cascade, you know, this sympathetic fight or flight reflex reaction where it produces all these what we call them neurotransmitters or hormones that just kind of exacerbates, you know, where you're at already. So it's this process of, you know, having these cyclical low oxygen levels that happen throughout the night where you wake yourself up transiently, and then you release these chemicals, then you go back to sleep again, and it happens again, and it keeps happening over time. That your body develops this kind of heightened state where your blood pressure now is no longer controlled, because you're always in this kind of fight or flight mode, and your body is producing all these inflammatory hormones that are just kind of making the process even worse. So there is a clear correlation between untreated sleep apnea with high blood pressure, specifically uncontrolled blood pressure, specifically when you see young people, you know, that you cannot explain why they're struggling with high blood pressure. You know, one of the most kind of common causes that is underappreciated is untreated sleep apnea. And then, of course, the other medical conditions like heart disease, whether that's heart failure or blockages of the plumbing of your heart, you know, strokes, rhythm problems. You know, atrial fibrillation is a very common abnormal rhythm that a lot of folks struggle with. And again, it comes from those dips, those cyclical dips of your oxygen being low, then coming back up, and then going back low. And then your heart's having to compensate by working so hard that you put yourself into these rhythm problems.
So I was diagnosed years ago. I'm sorry, Dr. Kane, real quick. I was diagnosed years ago. And I remember when they told me how many times I was stopping breathing.
Yeah.
That did it for me. I'm just like, what?
Yeah.
You know, and that's all they needed to say to me. And so that's why I just assumed that was a normal conversation that people had with their physician. Go ahead, Dr. King.
Well, since you bring that up, that's a good lead into what I do in terms of primary care guy. You know, I'm before I get them to Dr. Washir, I'm trying to screen them out and find out who I need to send to Dr. Washir.
Yeah.
Okay. So some of the things I ask the patients, and as you know, I'm talking to other primary care physicians as well as patients that listen to our podcast. Yeah, I listen for that loud snoring.
Right.
You know, it ain't just one night where you just extremely tired and it's over, you know, that night. It's habitual. I mean, you're snoring, you know, to the point if you're married, you know, you wake up and your spouse is out there on the couch somewhere.
Right.
Not necessarily does it have to be that bad for us to start trying to do something about it, but it can get that bad. The other thing is, speaking of spouse, we're trying to make sure, do they witness that person stop breathing?
Yeah.
Okay. That's called apnea. If we witness whether or not they stop breathing, and a lot of times I hear patients say, you know, I have to look over there and see if he's still alive.
Yeah.
You know, I have to shake him and so on, so on, so. The other thing, as far as the patient is concerned, you may see people that are really sleeping throughout the day. I have some patients come into the office and I walk up to the room and I can hear that loud snoring. I'm going like, they ain't been in there 10 minutes.
Yeah.
You know, and they snoring so loud, it sounds like a buzzsaw in there. We also sometimes they wake up with a with a headache.
Headache. Mm-hmm.
Yep. And other times, you know, they have to get up, and for us men especially, we have to get up several times a night, and
Go use the
sometimes
bathroom. Yeah.
differentiate whether or not getting up several times a night and go to the restroom, you know, is from prostate issue or sleep apnea, because
blood
both
sugar
can cause the issue.
Yeah.
Well, I have a real quick question I wanted to throw out there. We've in this short time we've spoke a lot about snoring. So is snoring only associated with sleep apnea, or the snoring can it also be related to something else?
Yeah, great question. Great question. So believe it or not, there is a myth. There's a myth that everybody that snores has sleep apnea. So that is a myth. So let's unpack that further. So there is literally a diagnosis, an ICD diagnosis called primary snoring. And essentially what that means is, you know, there's some people that snore, but it doesn't deteriorate where they're having, you know, what Dr. Kane referred to as apneas, or what we call hypopneas. You know, an apnea is really where you actually stop to breathe, and you're trying to, but you can't because the airway is blocked. A hypopnea is where, you know, the airway partially collapses, not all the way, you know, about 30%, give or take. So, you know, as you can imagine, you know, Ms. Jocelyn has talked about loud snoring or people gasping, you know, and you can imagine the people that collapse their airway 100%, total collapse, those are the people that you're going to hear them gasping and choking and snorting. You know, the people that, you know, the tube is narrowing, but maybe not all the way, or maybe not to that hypopnea stage, you know, all they have is really snoring, you know. So there's a lot of people that snore that don't have sleep apnea, but most people that have sleep apnea snore, if that makes any sense.
What groups of people are at higher risk of developing sleep apnea?
Yeah, very good. So risk factors, there's a lot of risk factors, some of them that are controllable and some of them that are not. So the biggest one is, believe it or not, age. So that's one that you and I cannot control. As we get older, we're more prone to get sleep apnea. And again, it makes perfect sense. If you remember what I told you about those muscular structures in our mouth, you know, they're just like any muscle, right? As far as tone is concerned, right? The younger you and I are, the more tone and you know and tight those muscles are. As we get a little bit older, then they become a little floppy, you know, they become a little, you know, loose, and so they tend to collapse with position. So as we get older, you know, and all the, you know, all the muscles are losing that tone, then it increases our prevalence for having sleep apnea. So age is one. As you can imagine, weight is another big one. That's one that we can control, all of us. And it's the same concept. You know, the more tissue you have around your neck and around your mouth, the more pressure it's putting, you know, on those muscular structures at the back of your throat. And that's extra weight to your, you know, to your airway to try and fight. And so, you know, the more pressure you pack on that airway, the higher the chances of it collapsing. Now, other things are, believe it or not, male sex. If you look at individuals less than age, you know, 65, there is, if you look at between male and female sex are twice to 3 times more prevalent to have sleep apnea than women. But you know what happens? Women catch up to men after menopause. So there is a hormonal relationship. Both progesterone and estrogen are actually protective to sleep apnea. And so when women get into menopause, they actually accelerate and are basically have the exact same risk profile as a male. Now, other things like alcohol, you know, what alcohol does, again, it relaxes the muscular tone of your mouth, and again increases the ability of that airway to collapse. Let's see. Another one that you and I cannot control is anatomy. You know, there are some people that just the way their mouth was created, really, you know, embryologically, they have a narrow kind of posterior pharynx, and so those people tend to have higher prevalences of sleep apnea. The other one is position. Most people, specifically like Mr. Tyrone was saying, people that have primary snoring, they tend to have it when they lay on their back. Like if they lay on their side, their spouse will say, "No, I don't hear him snoring." But when he lays on his back, yeah, I hear him snoring. And you know who's got that? Me. Every time I lay on my back, I get elbows from my wife. It's like, get on your side. And when I lay on my side, she's happy. She's like, it goes away. So sometimes it can be a positional thing, and again, it's just gravity. When you lay on your back, that tongue just falls down, kind of follows gravity. And if you got a narrow opening, it has the ability to kind of block the opening of your mouth. And then you're going to have those hypopneas and apneas. And then something like Dr. Kane and I have to be cognizant of is some medicines. There's a lot of medicines, like specifically like sleep medicines and pain medicines that predispose people to sleep apnea, because it's doing the same thing. It's relaxing those muscular structures, and again increasing the prevalence of sleep apnea.
So the sleep apnea.
The one thing that let me just add to it also, because you talked about anatomy, but I'm going to use the body morphology in terms of, with some things, as we get, particularly as men, when we get older, we get the big, some of us get big beer bellies.
Yeah.
What I try to tell patients is, think about how much fat you got around your waist. And some of us can have 40, 50, 60 pounds of excess fat around our waist. And that's like a 40, 60-pound kid sitting in your stomach. And so your lungs can't expand as easily. And it kind of increases your
prevalence for sleep apnea.
For the apnea episode.
Yeah, I want to ask real quick before we take our mid-show minute. When many people just think about sleep apnea in adults, can you explain how it shows up in children or teens?
Yeah. And it's a great question. And again, same thing. Unfortunately, if you look at the statistics, the prevalence of obesity in our kids is just through the roof, right? That's an area of concern, and it's even more concern of our people, our community, and a lot of that is just systemically. I mean, look at our inner cities; they're surrounded by fast food. You don't see salad places or any nice to eat places, but they park in just junk food, and they make that accessible to us and our people. And so, these foods are terrible for our kids, and they affect the metabolism, and then now obesity becomes an issue in our kids. And so, yes, there is a rising, unfortunately, prevalence when it comes to sleep apnea, that a lot of it is just related to weight. And then, of course, the other issues that we struggle with, whether that's just, the socioeconomic issues, whether that's just the biases, whether that's just the access to care. All those things are leading into to this high prevalence of sleep apnea. Now, what's interesting about kids is their symptoms are not like our symptoms. They tend to have more, kind of focus issues, even though adults can have the same things, and they might have more behavioral issues because they're not sleeping very well. And so a lot of times they actually get misdiagnosed with ADHD. So this is an area that as parents, we need to be cognizant, of our kids and our nephews and nieces, and specifically if they're overweight, if they struggle with big tonsils and big adenoids, those are things that also predispose kids to having these apnea episodes.
Wow, it's so much to learn. And that's why I tell people from week to week to tune in to Pause for the Truth, because to have experts such as yourself on to just break it down for us, because we really need to be in tune with what's going on. And we can't always compare ourselves to other people. We have to know our own bodies, and for parents to pay attention to their children's bodies. When we come back, we're going to continue the discussion with Dr. Wachira about the hidden dangers of sleep apnea. this is the moment where we give our behind the scenes guru, technology guru, Tyrone Jackson, an opportunity to enlighten us as we have a mid-show minute. Take it away, Tyrone.
Welcome to Pause for the Truth Mid-Show Minute. Today is November 18th, 2025. Tonight we spotlight a silent threat too often dismissed as just snoring, sleep apnea. It affects millions, fragments sleep, and strains the body in dangerous ways. And in our Black communities, the burden can be heavier, the diagnosis later, and outcomes worse. Here is what you need to know and what you can do. Sleep apnea is a disorder where breathing repeatedly stops and starts during sleep. The most common type, obstructive sleep apnea, happens when relaxed throat muscles block the airway. These pauses drop oxygen levels and jolt the cardiovascular system over and over. Sleep becomes fragmented, leaving you exhausted, foggy, and at risk. This is more than fatigue. It is a systemic health threat. Cardiovascular disease, higher blood pressure, more heart attacks, and atrial fibrillation. Stroke risk rises as oxygen drops and blood pressure surges overnight. Type 2 diabetes. Disrupted sleep impairs glucose regulation, cognitive decline, problems with memory, mood, and focus. Accidents, daytime sleepiness, triples crash, and workplace injury risk. An untreated moderate to severe sleep apnea raises the risk of death several-fold. Nearly 1 billion people worldwide live with sleep apnea. About 30 million Americans are affected, and most don't know it. Men are 2 to 4 times more likely to develop it. The women's risk climbs after menopause. Risk doubles after age 65. Obesity drives many cases, about 60% of moderate to severe apnea. But anyone at any weight can have sleep apnea. In Black communities, prevalence and severity are higher, and diagnosis is often delayed. Black men under 40 and over 60 are more likely to have severe apnea. Nearly 95% may remain undiagnosed, missing preventive care. Comorbidities like hypertension and diabetes are more common and more severe. Alarmingly, sleep apnea-related deaths continue to rise among Black men. Community-led awareness and screening can change this story. Access, trust, and timely care save lives. Untreated sleep apnea can raise cardiovascular mortality by up to 55%. It doubles the risk of stroke and heart failure. Over years, it can shorten life expectancy. But with diagnosis and treatment, outcomes improve dramatically. Here's what's new and what works. Home sleep tests and wearables bring diagnosis to your bedroom. Smartphone apps help track events and oxygen levels. CPAP tech has improved. Quieter devices, auto pressure, and built-in humidifiers. Portable units make therapy easier on the go.
Tyrone, just really, we didn't need you, Doctor. Well, that ends the podcast.
I know. That was unbelievable, Tyrone. Well done.
I know he did a great job. Let's talk about the process of getting evaluated for sleep apnea. What does that look like?
Yeah. So usually I get a referral from Dr. Kane. Usually what Dr. Kane does is, he does the original screening, and, he just asks the right questions. Do you snore loudly enough? Has your spouse complained that you're having episodes? Because, what's interesting is I would say majority of the patients come or are referred because of their spouses, not because of them. Because when you think about it, when you and I go to sleep, we go to sleep. We don't necessarily know what mannerisms or behaviors we're exhibiting while we're sleeping. And frankly, those arousal episodes that I was telling you happen so frequently. They're so transient and quick that most people don't even remember them the following day. So usually it takes, a significant other or a spouse or a child walking in saying, hey, I think you're like stopping to breathe and it's scaring me. And so they'll come over. to our clinic, and we do a good history, ask the right questions, just to kind of risk stratify them, and then we do an exam, physical exam. We look inside their mouth. We see how crowded their mouth is. We look at the size of their neck. In females, if it's greater than 16 centimeters, and in males, if it's greater than 17 centimeters, that increases your probability of having sleep apnea, again because of that extra tissue around your airway. We check their weight, and we ask them, how has your weight fluctuated over the last weeks to months? Are you plateaued? Are you gaining? Are you losing? Because we talked about the weight relationship there. We talk about lifestyles. Are they people that drink a lot or smoke? Believe it or not, smoking also increases your chances of sleep apnea, and it has a lot to do with inflammation within your airways. All those lifestyle choices again increase your chances of having sleep apnea. We look at what medicines that they're on. Are they on a lot of pain medicines? Because if they're chronic pain patients, we talked about that these medicines are associated with the risk of sleep apnea because they tend to relax that soft palate and that structure that we call the uvula. And then if they're women, we see they're postmenopausal, because we said that there's that relationship between estrogen and progesterone, and I forgot to say also testosterone. And that's why I said age is a factor, because men, as we get older, our testosterone levels decline, and that also is associated with high risk for sleep apnea. So once we do that history and physical, then we're able to risk stratify the patient, whether they're high risk or they're intermediate risk or they're low risk. If they're intermediate to high risk, then you can actually get away with a home sleep study. It's very efficient. It's very convenient. That's what most patients want, and frankly, that's what most insurances want. Sometimes they dictate the care. They don't want to pay for the much more expensive test, which is the in-lab sleep study, where you actually have to spend the night in the sleep lab. So most patients don't like that. They want something that's easy and convenient. They want to sleep in the comfort of their own bed. So we put them, based on kind of what category they're in. If they're moderates to high risk, you can get away with a home sleep study most of the times. If they're mild, you might want to consider doing the better test, which is the in-lab test, because their chances of missing mild sleep apnea with the home sleep study. So that tends to be the natural progression or steps of diagnosing the patients. Then of course you bring them back and go over the results, and depending on where they lie, sleep apnea is diagnosed in stages. Those episodes that we've been talking about, which is the stopping to breathe, which we call the apneas, and the slowdowns, which we call the hypopneas. You look at that events and you see how many events the patient is having. If they're having anywhere between 5 and 15 episodes, that is mild sleep apnea. If they're having 15 to 30 episodes, that's moderate sleep apnea, and anything greater than 30 episodes an hour, which is those oxygen episodes that we talked about, the fluctuations, then that's severe sleep apnea. And so treatment is based on the severity.
So
I'm sorry. Only thing I like to add is that there are some blood pressure medicines out there that may increase your risk for sleep apnea. And the other part is I love snitches. So I like for the spouses to come in and snitch on the patient. Yep. Because they act like they have Alzheimer's dementia, which is increased by sleep apnea. But they act like they have Alzheimer's dementia and forget to tell me stuff. But when them snitches come in, I love them.
So, Dr. Wachira, CPAP therapy is widely known but often misunderstood. Can you explain how it works and why it's effective?
Absolutely. So the treatment for sleep apnea is the gold standard is CPAP, and really what CPAP stands for is continuous positive airway pressure. Essentially, what it is You got this device that is pushing a pressure, and what it's doing is it's splinting that obstructed airway open. And if you remember that picture that I showed, you got that kink in the airway. So you push enough pressure to just keep that airway or keep that tongue or that uvula or that soft palate out of the way, so that the patient now is able to breathe in oxygen and is able to blow off carbon dioxide. So essentially, that's really what it is. It's a set pressure that splints or stents the airway open, so that you're not having those episodes where you're stopping to breathe and having to drop your oxygen levels.
Somebody asked, is there a cure for sleep apnea?
Yeah. So, Tyrone and I were talking about this, before the show started. So let me answer by saying this. So again, gold standard treatment is the CPAP device. Now, if you have mild sleep apnea, there are some oral appliances. If the patient does not want to wear CPAP, we can send them to a sleep dentist where they can get fitted with different kinds of oral appliances that they would have to wear at night. And really what these oral appliances do is, again, they push the tongue forward so that you're no longer having those partial or complete collapses of your airways. So that's for mild. But for moderate to severe sleep apnea, we tend to recommend CPAP, any form of what we call positive airway pressure, whether that's a CPAP. There's much fancier devices like a BiPAP and Trilogy.
Mm-hmm.
They get real fancy. Now, there are newer ways of treating sleep apnea. Now, the newer kid on the block, there are two things that are really, really gaining traction. One is what's called the Inspire device. Mm-hmm. So what this is, it's a device almost the size of a pacemaker. It's a generator that we place underneath your collarbone. And it has two sensors. One that senses when you're about to take a breath, what we call inspiration. And then the other sensor that stimulates what's called the hypoglossal nerve. This is a nerve that moves the tongue. And so what happens is, once this device is implanted, and again, unfortunately, this is a surgical procedure that is done by ENT, ear, nose, and throat doctor. They put this little device underneath your collarbone. Once it's matured, we give you actually a remote control. So you actually turn this device on before you go to bed. And so what happens is, when you are having these apnea episodes at night, that one of those leads that is connected to your respiratory muscles senses that you are trying to take a breath. And so the other sensor tells your tongue, communicates to your tongue to push the tongue out of the way so that you're no longer having these apnea episodes. So the Inspire device is a new thing that we're using. Now, I got to be careful here. It's designed for people that you've tried them on CPAP, because remember, CPAP is still gold standard. So you've tried them on CPAP, but they have failed. It's just not for them. You've tried every trick you can think of, and they're just not tolerating it. And so these are the people that we move to the Inspire device for. Now, the other new thing is weight loss medicines, and specifically, there's a shot that's called Zepbound. As you guys know, weight loss therapies have just they've been just gaining so much traction for multiple reasons. And so recently, this one particular IV medicine has been shown to help with weight loss, and at the same token help with sleep apnea. And so now it's been FDA approved, and we are starting patients that qualify for it for sleep apnea.
Yeah, I was just about to ask, are there specific diet or exercise recommendations that can meaningfully improve symptoms?
Yeah. I mean, it's the things that we all talk about. It's watching what you're eating, which is going to translate to hopefully the right weight, you being in the right BMI, which we've established that weight is one of the bigger risk factors for this, and then just physical exercise. And to your question, which I think I didn't fully answer, yes, sleep apnea is reversible. Now it's not reversible for everyone, but if your biggest contributing factor to sleep apnea is weight, and we put you on these weight loss medicines, or you watch what you're eating, and you engage in physical activity, and you get to your target BMI, a lot of people, we end up repeating their sleep studies, and their sleep apnea has gone away. Now, if the reason you have sleep apnea is your anatomy, then you don't even have to be overweight for you to have sleep apnea, because that's not what's causing your sleep apnea. Now, if your sleep apnea is because of medicines, if we can get you off some of these medicines, then it can go away. So it all kind of depends on what's causing the sleep apnea. But because we know that weight is a huge component, there's a huge percentage of individuals, whether that's bariatric surgery, we got all kinds of surgeries now. You got sleeves and links and bypass surgeries, to just kind of aid in that weight loss. If the patient chooses to pursue those interventions, a lot of times they come back within a year or so and repeat their sleep studies, and they no longer have sleep apnea.
Oh, that's a lot. I tell you what, if you're just tuning in, we're talking about the hidden dangers of sleep apnea. When I talk to people about this particular topic tonight, Dr. Wachira, it was a very important, people laugh like, oh my God, my husband needs to watch this, or my wife needs to watch this, because it just seems so common. But how can partners or family members support someone who may be living with sleep apnea?
Yeah, I think one is just normal. Yeah. I think one is just normalizing the conversation. I think, and really what I tell most spouses that come in, Dr. Kane was talking about snitches, is just really just voice that they're coming from a place of love. They care about you. You're scaring them at night. They're having to shake you just to make sure you're alive. That's not a good experience for a spouse to go through, or significant other to go through. So really, this is just a cry for help that is really rooted in care and love for their loved one. It's saying, you need to get that checked out because it's scaring me. So it's just kind of normalizing that conversation. And then it's just saying, this is a very manageable condition if you have it. This is not the end of the world. And then also reassuring them that, that you're there to support them. And I think if they have it, I'm not making this up. I have so many patients that come back and, get me a card or give me a hug and say, listen, doc, I have never felt like this. I haven't felt this good in decades or years, because think about it. We talk about the whole oxygen analogy, right? So that car has been running on empty for God knows how long, right? And so things have been breaking down for a long time. And then all of a sudden, you take that, car to the shop and you fixed everything, and it's running like brand new, right? And so they feel so much better once those oxygen stores are replenished, and they have their energy back. They have their memory back. In some people, the fogginess is gone. They're having restorative sleep. Where they just feel like they used to feel. So just kind of painting that picture that it's achievable, but it's going to take teamwork. And then just urging family members just to be patient. Sometimes it's the delivery. I'm a girl dad of two girls, and what I'm learning is I could say the same thing two different ways, and depending on my delivery will determine the outcome. A great example that I use is Nike. Just them adding "just do it." Just saying "just do it" as opposed to saying "do it" makes the tone is different, right? So the way we deliver our care, the way we deliver our concerns, if you go to your spouse or your significant other or your family member and say, what, this might not be anything, but when you fall asleep, you have these mannerisms and behaviors that kind of look like sleep apnea or sound like sleep apnea, and I think it'll be good for you, if you had it checked out, just the way you delivered that message, as opposed to complaining and scaring people, I think determines how the person receives it and what they do at the end.
It's so
You know,
many
as
people.
a
Before I want to put that comment, but it's so many people. Hold on a second, Dr. Kane. There are so many people now when I fly who have CPAP machines. We just look at each other like, oh, let me see yours. You know what I
Yeah.
mean? It's almost
Yeah.
you make a joke of it. But we
Yeah.
do have a comment. As an observer of a spouse, is there a way to determine when it's dangerous?
well, that's one of the things I was going to throw at and ask Dr. Rashir to comment on. One of the things that when I talk to these patients whom tend to sometimes dismiss sleep apnea just because it's
Yeah.
snoring,
Yeah.
and I try to make them understand the danger of sleep apnea is the fact that they're being somewhat selfish as it relates to the family, because the other risk, the other issues that are associated with sleep apnea, such as having AFib, having a heart attack, having a stroke, where your family has to come in and take care of you,
Yeah.
okay, post stroke, after a
Yep.
stroke,
Yep.
but after a heart attack, it's just, not to mention in men, and that tend to get their attention quite a bit, is erectile dysfunction, which is a heart attack just below the waist.
Yep.
And for them, for them to get to appreciate what what they're up against, and the longevity and the quality of life
Right.
is tremendously improved when you handle the sleep apnea and address it like an adult. Now, I'm not shaming anybody on that part.
Right.
You got to think about your family. Dr. Washira quickly says how he has 2 girls. I remember having 3 girls, and it's just like, I gotta be here. I gotta
Yeah.
be here.
Yeah.
And so did everything we can to stay here for our kids. Now, Tyrone, I know you used to say that about your boys, that you needed to be around because they needed their dad, just like my girls needed their
Right.
dad.
Right. Right.
So, what are 3 signs someone listening should not ignore, Dr. Washira?
Yeah. I would say, loud snoring, not just snoring, like Tyrone had asked earlier, specifically very, very loud snoring where, you know, your significant other or your spouse literally has to leave the bedroom to go sleep somewhere else. That's a huge red flag. Um, choking or gasping or snorting, periodically, in the middle of the night. That's a big one. And I would say excessive daytime sleepiness. If you feel real sleepy the following day, come afternoon, if somebody could take you up on a nap, you would take them up on it. I would say those big 3. I would have, and I would say fatigue. Out of the ordinary fatigue. That's another big one. And I'll add this: morning headaches. Morning headaches is a big, big red flag, because what happens is, like we talked about before, your carbon dioxide levels rise. And so what carbon dioxide does, it tends to vasodilate your blood vessels. It makes them kind of, more dilated. And that's actually what causes morning headaches. And we actually see that in patients with severe sleep apnea. So if you're having morning headaches, you're tired out of the ordinary, your significant other is saying, you snore real loudly, and you have episodes where, you're choking or gasping. Those are huge red flags. And like Dr. Kane said earlier, for reasons that we don't fully understand, the frequency to use the bathroom at night, if you're waking up multiple times to go use the bathroom, that's another red flag. Now, there are other things that can cause that. If you're male sex, obviously prostate issues or diabetes issues is what can do that. So you gotta have to tease out what's causing that. But those are very high risk symptoms, I would say.
Dr. Kane, I
That's a
want
good
to thank you,
part of my job.
Dr. Kane, this question is for you. What advice would you give to someone who suspects they have? No, I'm sorry. How can listeners start a conversation with their primary care physician about getting evaluated? Everybody is not going to Dr. Rogers Kane as their primary care provider. So what should they say to get an evaluation for sleep apnea?
Well, a couple of things. As long as first of all, our listeners start being honest with themselves in terms of the medical condition. So if they recognize that they have high blood pressure, they recognize they have diabetes, they recognize that they are overweight, then one of the, and especially if the spouse or someone who can witness their sleep, because as they tell me, hey, I'm asleep, I don't know if I'm snoring or not, but especially if their spouse or significant others, kids, whomever, relate to that, then they need to say, Doc, this is what's going on with me. I got this diabetes, I got this high blood pressure, I'm on these medications. Can I have sleep apnea, especially when I'm tired all the time? I can't sit down for a good 10 minutes before I fall off to sleep. Really severe ones may even be at the red light and fall asleep at the red light. That's pretty bad, but I've seen it. And you're trying to hurry up and get these people to someone before they hurt themselves.
Yeah.
The last thing I'd say that sometimes people are not paying attention to is palpitations, funny heartbeats. Okay, that could be a sign of AFib, but it could show as a result of oxygen starvation to the heart, yada yada yada, during the sleep apnea episodes. So if they have any of those concerns, have others, but especially those, then they need to mention that to their primary care without reservation. Why are you paying us if you're gonna come to my office and you're not gonna ask me any questions? What you paying me for? I mean, I'm sitting and play some kind of puzzle game with you or something. That's what you want. But you come there to pay me to do a job.
Right.
And that'd be like anybody else. You're going there to pay them to do a job. If your plumber come there, you're not sitting there waiting for him to talk about the weather. You want
but it's not always that, Dr. Kane. It's being blown off for it's something else, or it's not that, or you're a thin person. That's not the case. To me, you just sometimes get blown off and it's not taken as seriously, particularly if you're a single person and you don't have the luxury of a spouse telling you that you're snoring. Dr. Washira, did you have
question, JT, before I forget, don't forget the old adage that we always talked about. When you go see your doctor, kind of write down some of the questions that you have before you get there.
Yeah. So true. So Dr. Washira, what is one thing you hope people walk away understanding about sleep apnea that could truly change their life?
Yeah. Wow. Yeah. One is, it's underappreciated, and I think it's a vital condition that needs to be talked about more. It needs to be entertained a lot more. A lot of the usual illnesses or comorbid conditions like Mr. Tyrone highlighted earlier, whether that's uncontrolled blood pressure or uncontrolled type 2 diabetes, or cholesterol issues or heart issues, whether that's rhythm issues or plumbing issues or heart failure, strokes, memory issues. All these things are tied to sleep apnea, and it's such a simple illness to diagnose and frankly to treat, because we got all these nuances now of treating. It's not just, old CPAP. And frankly, even with CPAP, we've come such a mighty long way in the devices, in terms of, the size of them. You were talking about earlier about, the ability to take them with you if you're flying. We even have portable, CPAPs where they're the size of your phone. If you want to, if you fly frequently, you don't have to bring the entire device with you. We can get you a much smaller one where it's more convenient for you as far as luggage is concerned. So we've come a really long way from, how we diagnose sleep apnea, how we treat it. We got different ways of treating it. If CPAP is not for you, that's not the end all be all. There are medicines, and there are actually other things in the pipelines that are coming. There are pills that are being investigated as we're speaking.
What?
Yep, you heard that right. Not a shot, a pill.
Wow.
We got different devices. I know we talked about the Inspire device. We got other devices that are being investigated right now. So, the fact that this is a condition that is associated with such high mortality and morbidity, and yet it's simple to treat. We have to entertain it. Now, I do think, to your point, Ms. Jocelyn, all of us have to do our part. And I think, which you guys do such a good job, is you're offering this information. I think the good book says we perish because of lack of knowledge, right? And so, and to me, you can even argue lack of knowledge sometimes is ignorance. Sometimes, we live in a world where now knowledge is ubiquitous. All you got to do is just go to AI and you type in anything and it gives you all kinds of information.
Yes.
So we can't make that excuse anymore that we don't have the knowledge. We have it at our fingertips. It's actually too much knowledge right now. So the question is, what are we going to do with that knowledge? And so if you go to your primary care doctor and you say, you know what, I am concerned about this condition. I'm young and I got blood pressure that is not responding to typical medicines, and you get brushed off. Well, guess what? Go see another doctor. I always tell my patients, listen, if you don't like what I'm telling you and you want to hear it from somebody else, 100% go for it. If I get offended, that's on me. You don't owe me any explanation. Go see somebody else. That will value you. That I think all of us saw what happened to that pregnant lady in Texas, right? It was a shame. So there are people that we need to put out of business. People that they're not good docs, and they don't practice good medicine. They're not kind to their patients. They don't listen to their patients. So if there are people like that, stop going to them. Go find. There are other people like Dr. Kane that will listen to you. And so we got to do our part. We got to get the knowledge. We got to use that knowledge. Now, and we got to normalize these issues. Sometimes I do think, specifically as Black men, like going to see our primary care doctor, that's got to be like a normal thing. And if it means us going to barbershops or churches to just have these conversations, because that's how we're going to make a change in our community, is normalizing these issues. And it doesn't make you less of a man to wear CPAP or or to be vulnerable. These issues that sort of have become stereotypes in our community. We got to normalize them, but we also got to meet people where they're at, speak their language, deliver it in a way that it can be received, because that's how you impact people. And continue these conversations.
Yeah, I want to ask a question regarding, if you use a CPAP machine and you get congested and you can't not sleep with it, do you or Dr. Kane have any advice for folks?
Absolutely. Absolutely.
Or if the power goes out and it's a storm, it's hurricane season, what advice can you give folks?
So that's a point that we didn't address. So nasal congestion is actually an independent risk factor for sleep apnea. But again, it goes back to the image in the beginning where we showed the air going through the nose and the mouth all the way down, right? So if there's any sort of congestion in your nose, that air is limited going in, right? So there are things that we can do to help with that. One is humidification. You can adjust, just about all these new devices now have some form of humidification, and you can actually change the temperature. You can play around with the temperature. Some people like it high, some people like it low. So you can adjust that. That's a very easy thing to try. The other thing is good old saline drops in your nose, because you want to make sure that your nasal passage is as moist as possible. So if the humidification in and of itself is not sufficient, then you could try those just saline sprays. And sometimes you need to use nasal sprays, like corticosteroid sprays, the same ones that we use for allergies, something like Flonase or Nasacort. Because sometimes what ends up happening is, if you have a lot of inflammation within your nose because of allergies or whatever reason, again, it's causing that blockage. And so sometimes you actually have to use inhaled nasal corticosteroids to kind of get ahead of things. And I tell my patients, if you're having a flare of your allergies, skipping a day or two is not going to hurt the bank, because you don't want to push all of that air when your nose is stuffed up. It's very uncomfortable for patients. So I tell them all the time, you don't have to wear it for a couple of days until we kind of get ahead of things. And sometimes when all else fails, we put them on a couple of days of prednisone, which is the strongest anti-inflammatory, to kind of open up their nasal passages.
Well, we thank you, Dr. Wachira. This has been great discussion. I know I've been getting texts from folks, and I know that somebody learned one thing tonight, and it's the final moment. And I just have to say, is there anything we didn't talk about that you'd like to say before we close out tonight's show?
Let me look at my cheat sheet here real quick. I don't think so.
Somebody did post something about abnormal movement. That was the only thing that we didn't mention.
Yeah, if every patient has different manifestations of sleep apnea. So there's something called rest like leg syndrome. And this is where some patients that have obstructive sleep apnea will have kind of jerky movements, and so it is associated with sleep apnea. And actually, most people, all you have to do is actually treat the sleep apnea, and those movements go away. Now, there are some patients where you have to supplement medicines with the CPAP or with the other mode of treatment that you choose, because treating sleep apnea in and of itself is not sufficient. So that's probably what they're referring to. But those are, again, manageable issues or conditions.
Thank you. Thank you. Thank you so much. Dr. Kane, do you have any final thoughts?
Real quick, I am so happy that Dr. Washira came on and helped us navigate through the difficult waters of sleep apnea. Because it affects so much. Not only do do we have to worry about patients being obese, that develop, and they develop sleep apnea, but it can go the other way around, because you got sleep apnea, you wind up getting obese, or more obese than than you would have without sleep apnea.
Yeah.
You got to look at high blood pressure, the cholesterol, the elevated the diabetes, or increase of blood sugars. Your risk for increased motor vehicle accidents, because you're drowsy and sleeping at the wheel. And if your family's in the car with you, and you never forgive yourself if you cause harm to, I know Dr. Washira wouldn't, if it's his 2 girls, or me with my 3 girls, when I, especially at their younger age, and so these days grandchildren. So all of those things are, and we're just barely scratching the surface of sleep apnea and the consequences of sleep apnea. What we will probably do is request from Dr. Washira any slides or anything that he has that we can put on the website, and patients want to come back and go look at our website, and they can find that information. But again, thank you, Dr. Washira, for joining us this evening. I turn it back over to you, Ms. Turner.
Thank you, Dr. Kane. Tyrone, is there anything you'd like to say? You stayed on camera this time.
You know how I like to have that symmetry. I like the 4 squares versus 3. I did want to say, because it's one of the things that you had asked about, why do people allow this here to go on? And it's something that I've discovered as a recurrent theme throughout the topics that we discuss. So often when we do things and we don't feel the pain right away, we push it away. We wait till we hurt. We wait till we have the pain before we look to act. So this is one of those things where you listen to your spouse and listen to those who are hearing you snore and care for you, and decide to at least get it investigated. Talk with your primary care, and make sure your primary care does its job, and then get you over to someone that can help you.
We are employed by you. I just want to remind people, you pay to come see me. So for that, those 10, 20, 30 minutes, whatever it may be, you're my employee. So don't forget.
Thank you. Thank you all. Thank you, Dr. Washira, for sharing your expertise and for shedding light on a condition that far too many people overlook or misunderstand. Your insights tonight have truly helped us understand the seriousness of sleep apnea, the risk of leaving it untreated, and the hope that comes with proper diagnosis and treatment. To our listeners, if you heard something tonight that sounded familiar, whether it's loud snoring, waking up tired, struggling to concentrate, or just not feeling like yourself, please don't ignore it. Talk to your doctor. Ask for a sleep evaluation. Your health, your energy, and even your life could depend on it. At Pause for the Truth, we believe knowledge is power, and taking action is where the real change happens. Next week is Thanksgiving. So guess what? We're going to take a break. We're going to have a repeat broadcast, but it's going to be something good, still worthwhile tuning in advance. Thank you for tuning in. Thank you, or happy Thanksgiving, I should say. Thank you for joining us this evening. Be sure to follow, subscribe, and share this episode with someone who may need to hear it. Until next time, stay informed, stay empowered, and as always, pause for the truth.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.